So the issue of professionalism is one that frequently rises to the surface, and we can talk about the attitudes and the knowledge, and we can document those. But in fact, what we really want to do is look at the practice of this competency of professionalism across the spectrum of medical education. Within Canada, the issue of professionalism comes up frequently, and there is a project undergoing at the present time dealing with the future of medical education in Canada. That component dealing with the undergraduate group has been published, and the issue of professionalism is outlined as a characteristic and an initiative that needs to be followed. Within the Royal College of Physicians and Surgeons of Canada, we deal with all specialties, and therefore we need to ensure that all specialties are imbued with the attitudes, the skills, and the practice of professionalism. And in fact, in the postgraduate phase of the Future of Medical Education project, which will be announced and launched at the end of next month, the need to pursue professional attitudes and behaviors as well as teaching them is outlined. But additionally, we also need to ensure that all of our colleagues are able to reflect on their professional attitudes, skills, and practices, and indeed weave that into their curriculum of lifelong learning. Within our curriculum, we have, since its inception, identified as one of the key intrinsic roles within the CanMEDS framework, that of professionalism. And indeed, we'll use the statement which we have agreed to and participated in to advise and inform the rewrite of the CanMEDS document, which is due for release in 2015. But we've also, as part of our strategic plan, commissioned a series of white papers looking at various aspects of the practice of medicine and the education of healthcare professionals. And one of our papers does deal with the issue of professionalism, again demonstrating our commitment. I do not think that anything that we have said or done is out of line at all with the agreed statement, and therefore I'm happy to say that we are active and very active participants in this. Our learning strategies to promote lifelong learning need to ensure that professionalism is incorporated in that, and in fact in our maintenance of competence, maintenance of certification programs across all domains, professionalism is identified. As a student, and that would be a student at any level, from the undergraduate to the postgraduate, to the student engaged in lifelong learning to maintain his or her practice, we need to ensure that we embody the attitudes, skills, and the practices of professionalism within the context of what we all do. At this point in time, I think all I can conclude with is that the issues and attitudes and the whole topic of professionalism is indeed an international topic to which we have, I think, made significant strides in getting 3 major colleges to agree to what we mean to discuss and our way forward in that regard. So with that, I will end.